You need to monitor well, tell them that, okay, if you're going to eat this, it has so much carbs, you can count the carbs and take insulin accordingly. On the day the child is sick and doesn't feel like eating, you'll have parents force feeding the child. A lot of times in the night they force feed, bedtime, raat ko, in the night the sugars might drop. There might be nocturnal hypoglycemia. So all of this, how to manage that, because you need not always force feed the child. For that, maybe you can give a little lesser insulin if the child is not feeling like eating too much and eats a little less. And it happens to all of us, right? On a certain day, we don't feel like eating too much. So how do we manage that? So based on the carbohydrate counting is nothing but 1 unit of insulin takes care of how many grams of carbohydrate. So that's what we teach. So they know, okay, I'm going to eat XYZ amount of carbohydrates, so I need these many units of insulin to cover it. And once they learn that art, they get more flexibility. So then then there's no question of hiding and feeling, because they can then participate in social events and go out with friends and do all of that. But the basic discipline of healthy eating has to be there, and it has to be there in all of us. So that is what medical nutrition therapy is about, getting a basic discipline in the way you eat, so that you are having, yes, the blood glucose in control, but also leading a healthy life. Otherwise, where we are not running into any kind of complications and are seeing good growth as well. I think I would like to emphasize that, because that's very important, because when in type 1, we normally see more of kids and growth should not be compromised. So yeah, that is what we, actually emphasize on and make sure that they're able to eat all kinds of food. But as I said, when, how much, and when in the day, and what kind of food, that is what we actually just teach them, and then they're happy after that.
Thank you, Ms. Natasha. So you have highlighted a very important point. This is what I want to address with the audience, especially to those with type 1 diabetes and their parents. Now, when we say diet, often they feel like a sentence has been passed to them, and that, they can't eat this, they can't eat that. But when we say diet, we mean modifications in your diet, the food groups that are involved. And diet is not only for individuals with diabetes, it is for people without diabetes or other health conditions, okay? Because that is what we want to emphasize in our health promotion activities. To prevent the future risk of non-communicable diseases, it is imperative that, we implement lifestyle measures from the beginning itself, that is from childhood. We can't wait for a condition to happen and then decide that we'll go on diet and exercise. So this is what we implement daily in our routine practice as healthcare professionals, the role of health promotion activities through IC activities, that is information, education and communication. So lifestyle management, dietary modifications, it is for all individuals, every individuals, whether they are living with a health condition or not. Coming to the diabetes in general. Okay, it is an emerging public health problem, okay? It's actually a global pandemic, okay? And for a healthcare program, especially specific to diabetes, we need several key stakeholders for a healthcare program to function efficiently. So I would like to come to Mr. John Daber, who has several years of experience in the healthcare and pharmaceutical industry. So why did you get involved with Team Novo Nordisk, and how do you feel, about the impact that it can make with a public health problem such as diabetes?
Thank you very much, and good afternoon. It's a privilege and honestly very humbling to be part of this hugely esteemed panel, and thank you to all my colleagues and contributors. I'm sure you have learned just as much as I have learned over the last hour or so. I'm a simple guy who has worked his entire career in the pharmaceutical industry. I work for a healthcare company. We are called Novo Nordisk. And this company was born just a little more than 100 years ago around the discovery of insulin. And today, 100 years later, we're privileged to supply about half the world's insulin. And it's very easy for a drug company to sit back and say, okay, we do this, we research, we develop, we manufacture high quality treatments, nothing else. But about 12 years ago, when I was lucky enough to be working in our headquarters in Denmark, we were debating, surely there should be something else we could do. We should do more. And actually we were fortunate enough and lucky enough to be approached by essentially Logan's big boss, who was organizing a team of type 1 diabetes athletes, cyclists. And he was looking for sponsorship. And we said, this maybe is the route for us to do more, to give back, irrespective of the medicine. It's a responsibility that our founders, at that point 90-something years before, told us we should do, and we feel that we will still be working in diabetes 100 years from now also. We also felt that type 1 diabetes was being somewhat underrepresented. So it seemed a very nice fit. And then we started to look a little more, and we created this vision for Team Novo Nordisk as the sponsor of this cycling team. And the vision was to educate, to empower, and to inspire. And then it becomes really clear that you, as a drug company, you're actually a small part of an enormous ecosystem to care for somebody with type 1 diabetes. You know, here the room is half filled with educators, working with diabetes educators. Your job is much more important than the drug. And the work that we can do to help educate and help share your word is super important. Then it comes to empowering. The room is filled with people who have got life experience of working and living with type 1 diabetes. And if we can do something to improve that empowerment, then we're doing something good. And then it comes to inspiring, and the idea of working with a team of professional athletes who can go around the world living their dream and performing at the highest level is probably one of the best kind of inspirations that we could work with. But you know, you told your phrase, I thought, was incredible, of advocacy starts with something that makes your blood boil. And I'd like to close with a little personal story of how my advocacy with Team Novo Nordisk really went to a different level. So we'd started this sponsorship in 2012. I was lucky enough to be moved by the company to work in Japan. And we were hosting the cycling team racing in Japan in a city called Utsunomiya. It's north of Tokyo. And I was the guy, the marketing guy, just walking along the street, and I had my t-shirt with Team Novo Nordisk. No bigger role than that. And suddenly this lady stopped me in the street with this young boy. He was 9 years old. And she said, "Excuse me." She said, "Excuse me, I've brought my son here because your Team Novo Nordisk is racing, and I think maybe he could be inspired by what these guys do." I was filled with pride, and I started talking, "Isn't this marvelous? This is wonderful. I'm really happy. Well done." And then came the but. And she turned away from her son and started talking to me quietly. And the but was this. She said, "But I've researched this condition on the internet. And I know," she was certain, "I know it doesn't look good. I know he will never get married. I know he will never have a proper job. I know he will never be able to achieve his dreams. And I've learned that already, and I feel so sad. But I just hope that he can get a little bit of inspiration here. And that's when my blood boiled. And that's when we said, hey, let's come and meet the team. Let's come and talk to these people who have got girlfriends, got wives, got children, got jobs, and are competing and living their dreams the highest possible level in the world. And I thought, that's the moment, after a long, long, long career in this industry, we managed to change a life, or the outcome of a life. And that family kept coming back year after year after year to support this team at that race. And I realized that was my blood-boiling moment, when this sponsorship of this professional cycling team, one by one, is going to make a big, big difference. But it takes the diabetes educators, it takes the advocates, it takes the doctors, it takes everybody to be able to join that journey. And so it's a huge privilege to be here. Thank you very much.
Thank you, Mr. Dawar. This is really truly inspirational, the efforts that has been put in by Team Novo Nordisk. Coming to our second round, I would like to come back to Dr. Ankush once again. If you could please talk about the newer therapies available, especially the availability of free insulin and the insulin pumps that are, now much, available, and any other technological advances. How do you go about, how do individuals with type 1 diabetes go about monitoring their blood glucose? Okay, the different techniques that are available.
Yeah, it's been a long time, I think so, as I spoke. So 1 hour later, literally, almost, no? So I hope we do not spend that much amount of time, because we then need to sort of break for lunch, right? I'll keep it a bit short, very quickly. So here is Karthik, there is Divya, there is Shravya, there is Dhruv, there are so many others here who have spent a lot of years with me. One of the things which they would always feel about me is, why does Ankush give them the injections? That's a big question which is there. So if you look at the world before insulin came, the world was not very pretty. Elliot Jocelyn used to treat his patients with young diabetes, whether you call them type 1 diabetes or anything, with just diet, diet and diet. Starvation diets. Do not eat this, do not eat this, do not eat this, do not eat this, do not eat this. Literally. That world was not good. It was when Frederick Banting showed the use of the most impure form of insulin which can be used in this world, that for Leonard Thompson, the world changed. He, from a shriveled boy, became a healthy looking, handsome child. And then he went on to live in this world for almost like 70 odd years. I don't know whether Logan knows about his story. So what I want to say is that with changing times, there would be many advancements. We have seen the world. If you ask me, I've seen the world when I started this journey in diabetes or endocrinology, that children used to monitor urine sugars. They used to come to the clinic at the All India Institute, in their DOI clinics. They would dip their, get their urine, and there was this guy who used to sort of boil the urine and put the the urine to be put in the Benedict solution, and then the color change, and this is the amount of glucose that you have in your blood right now or in your body right now, they would say. Times have changed. We have got human insulins, and now we have got a lot of analogs, and I guess many of them would be using the analogs. So the government of Goa has been very kind to see to it that we get the most modern forms of insulin here. So that part, I think so, all of you all should be extremely clear that we have seen to it, the minister has been very, very strong in this, is let us get the best of insulins, and which are the most advanced ones, be the analogs, the ones which we use, insulin aspart, or the insulin degludec. This is in the world of diabetes, this is the most advanced thing. We are going to get smarter insulins in future, but this is the best which is there right now, and that is what is available in Goa. There is no doubt about that. That is as far as the insulins are concerned, and Novo has played a big role in seeing to it that we have got these insulins here also. The second part is, as I said, monitoring. We have mostly been doing previously urine sugar monitoring. And I remember when I came in 2009, 2010, at that time, there was hardly even a single patient who had a monitoring device on his own or her own. There was no one who carried a glucometer. It was very difficult for me to convince the people in the institute that you need to reimburse them for their meters, for their strips. And people told me, hello, people are not supposed to carry the meters home. They are supposed to keep it in the hospital. They used to come and do their device maximum here in the hospital. But it was not very difficult for me to tell Mr. Rani that sir, if we need to get glucometers, people have to be reimbursed these things. And today we find that almost everyone has a glucometer. That's still the journey which we've gone through. We have reached a situation where there is something called as continuous glucose monitoring. I know Karthikeya doesn't do it. I guess Logan must be doing it. And there must be others in this group who are doing continuous glucose monitoring. Sort of it might appear sleek, it might appear, something niche. No, I guess that's the way to do it. We need to see to it that most of our people get access to continuous glucose monitoring and they need to use it regularly, almost continuously. Because that's the way we are moving ahead. The third thing here is we started off using one injection, poking the big needles. I remember at your institute, people used to not use disposable syringes, reusable syringes, take the insulin and then inject again and again and again. Times have changed. Since I was in Goa, we have been fortunate enough, everyone has been using disposable syringes. We have had the access to the insulin pens right from the time when I have come here. Means the minister has been very kind to see to it that we have got these things. And I just hope that we start using the insulin pumps much more regularly. Erica is the only one probably who has the insulin pump right now. And I would want that we use the most advanced pump, which is the one which is available right now, which actually senses the glucose from the glucose sensor and closes the loop by giving the amount of insulin that the person needs. And if we can get AI into the field, we really do not need to do much amount of, the algorithms which is run in our head. Okay, how much does he need to take insulin in the morning? How much in the afternoon? Titrating the boluses and all. That would be done by the pump on its own, learning the individual. It's not for someone else. This pump is tailored for this guy because this pump has been with this guy for the last 3 months or 2 months and knows when does the sugar rise of this guy, which day does he do the cycling more, which day does he play badminton more, which day does he eat more. So if the pump knows that, the pump can use the previous knowledge to adjust the insulin doses accordingly. So that's where we are headed for. When I came here in 2009, there was hardly a single patient who used to do HbA1c. There was not even a single patient. It was so very difficult to convince the doctors that you need to do HbA1c because that's the measure of glycemia for people. That is where we started off. It took me 15 years. And while I don't know how many people have changed and how many people have started doing HbA1cs, times have changed. With CGM, with the closed loop systems, probably we are going to see a time where we are now looking at how much time does the person spend in range. I've still not done to most of my patients here. I have hardly told them to look at time in range. But Logan would acknowledge and understand this, is that we have to see to it that we spend more than 50% or 70% of the time of these children in range. So we are going to see a situation that HbA1c is probably going to get obsolete sooner or later. We are just going to see TIR time. BR has to be kept less than 1%. TAR maybe, some people might be 20%, some people might be 50%, 5%, but you have to see to it that you keep the time in range within, say, 70% or 80%. That's what we are looking at. So these are some of the things which we are going to see in the times ahead. And on a sort of a broader note, I remember when I started this whole journey of type 1 diabetes here in Goa Medical College, there's some children who started off with us. Today they're not there with us. So if Sushant would acknowledge, probably the number of people who got registered in our clinic, probably to meet me once or probably meet Sushant or just be part of the journey with Goa Medical College would have been nearly 1,000. Today, I think so there are, with us who are regularly, there are around 200, 250 odd. It's not that the others are not there, they just do not follow up. So if we had a center of excellence here, then we would see to it that we give them the best of care. And that would sort of encourage everyone to be with us forever. As long as they are in this world with their journey of diabetes, they would be with us. At the All India Institute, when I was there, we had at least 2,000 people who were registered in the clinic, the DOI clinic. And if you ask me how many were regularly coming, hardly 400. The same problem. So how to solve this problem is to have a center of excellence where you give dedicated care to these people and they feel empowered there. So these are the things which I'm looking out for next few years. Let's see how the journey goes. Yeah, done. Thank you.
Thank you, Dr. Ankush. Ms. Natasha, adding on to what Dr. Ankush said, monitoring of blood glucose, self-monitoring of blood glucose. We had discussed earlier, it's not a report card, okay? It's not just about the blood glucose readings. What is more to it? So what is the importance of self-monitoring of blood glucose and how does one go about it?
Thank you, Dr. Janice. So, self-monitoring of blood glucose, I think that itself talks a lot. It is about monitoring it for yourself. So first of all, I would like to emphasize that it's a very, very important pillar in the management of diabetes because it's like the speedometer of your car. When you're driving a car, you keep looking at the speedometer to know where you're going and how fast or slow you're going, right? Similarly, if you're too fast or too slow, you're going to lead into some trouble. Similarly, you need to know when you're taking some kind of a treatment for, the condition, you're taking the insulin, you may be following the diet, but you need to know how well it is actually working for you. And that's where the monitoring is very, very important because otherwise you're just playing a blind game. You don't know what's happening and you won't be able to correct it at the right time. So monitoring plays a very important role and we begin right from the basics of for those who do the SMBG, which is use of the glucometers, we prefer the 7-point system if they can do because that gives the best idea where you have like a pre-meal and a post-meal. That's your breakfast, lunch and dinner. So that's 6 readings there, pre and post, and 1 3 a.m. which is very important to understand what happens through the night and of course why the fastings are high or low. So that gives us a very important picture. But having said that, more than for the health professionals, of course, as dietitian and as a diabetes educator, I would want to see the log not only for the sugars but also for the food that they have, they have eaten, because only then can we associate, okay, this was eaten on breakfast on this day and this is what the sugar was like, and maybe the other day you ate something else, something with more protein and fiber, and see how it has made a different impact. So it's very important from us, from the compliance perspective, to explain to the individual as to how the food is working on their body. However, I would like to emphasize that since the self-monitoring of blood glucose is actually very important for the individual who is doing it to understand what is happening, what is happening when I take this insulin, when I take these many shots for this meal, what really happens. So the next time I do the same thing, I know how to correct it. I know whether I need more, I know whether I need less. So the whole titration of the insulin, the whole understanding of which food actually raises the sugar, which food reduces, and how you further balance it such that you can still, manage to eat something, but how can you control the sugars after that? It will only happen when you see the effect, and that's what monitoring does to you. And like Dr. Ankush rightly said, if one can do the CGM and can get their hands on it, can afford it, it's a wonderful system because it gives you the whole day's graph. It beautifully tells you how much percent you are in range, and when it goes, it gives you a trend. What it helps, CGM helps us understand a trend line that, okay, this individual specifically shows high sugars post breakfast or is dipping in the night. So, just doing 1 2 a.m. or a 3 a.m. is okay when you don't have the access to, but because today technology is progressing and if we can have our hands on it, it actually tells us what if you're dipping maybe, early down the morning, what if that early morning is low and then you're showing high. So it gives you a whole trend line. So we are able to then advise them accordingly, looking at the trends that look, we first show it to them, you can understand it, and then you say that, so you can see this mountain here, that the sugars are typically, rising up here, and that's because this is what is happening at this time. So maybe we can modify this and maybe, instead of this, we can try to eat this and see if that works for you. And then when you see the effect, the compliance happens. And once the compliance happens, then it's a self-motivated, a road where they are going because they've seen it for themselves. So I think from the compliance perspective for the healthcare professional And from just understanding how beautifully things work for you, how the treatment is doing, you get self-aware. You are actually monitoring yourself, so you know what is happening, and then you want to do it more and more to see what works for you, what does not, and you can take your decisions wisely. You can take your informed decisions, and I think it's a great tool to have and very important. And each one should, as much as monitoring, is possible, that is the best when it comes to the glucometer. And of course, when it's a CGM, yes, we do get a wonderful picture. And then, of course, even more advanced is your closed loop system, where the AI and the pump and the CGM work together and help us understand, and give the insulin by itself. So yes, technology is going ahead, and it's very, very important. And monitoring is the key in understanding how the treatment actually is working for you.
Thank you, Natasha. So this is, as Ms. Natasha highlighted, the self-monitoring of blood glucose, it's not only for healthcare professionals, it's even for individuals who have diabetes, to give them a better understanding of how their body metabolizes, certain food groups, and, how they can take charge of their diabetes and not the other way around. So we have, as I mentioned earlier, diabetes, the theme for this year is diabetes and well-being being not only physical, but mental and social well-being, which are equally important aspects while managing individuals with diabetes. So, Mr. Logan, I wanted to know what is your take on, the role of a strong, support system? How do you feel that impacts, individuals, when it comes to managing their condition? Yeah.
Thank you. I think that the role of a support system is critical. And I'll just give an example of me being with my teammates. Each of my teammates, we all have type 1 diabetes. Some of us have had it longer than others, and we have different experiences of it. Each of us have, we're our own little snowflakes when it comes to our experience with type 1 diabetes. But we all know that we have each other. We all know that on any given day, at any given race, that one of us could have something happen, whether it's a hypoglycemic episode or somebody's insulin is not working effectively. And we know how to work with each other on that. And we know how to say the right things. And we know how to call on support if we need anything further. And we know that we have reliance with one another. Another one of the great things about that is that for us, if we're sitting around the dinner table, we don't have to talk about diabetes. Because for us, yes, we are people with diabetes, but that's not all we are. We aren't just people with diabetes. We have different things that we're passionate about. We have different interests, and we can understand enough about each other to where we don't have to always be talking about it all the time. Another point of support comes obviously from the family. I think that having a child diagnosed with type 1 diabetes would be one of the greatest stresses that a parent could experience, and that diabetes diagnosis extends beyond the child to being with the parents. And through that, it takes an entire family to be able to know and cope and manage that diagnosis. And so then you need to consider the fact of okay, the parents are the support system for the child, but who's going to be the support system for the parents? And how are they going to find the support that they need to be able to stay level at, hopefully most of the time with what their child is going through? And for me, my support system has changed a little bit, because when I was first diagnosed, there was nobody else in my family who had type 1 diabetes. And so nobody knew anything about it. And, if I were waking up in the morning, if I were staying at my father's house and I'd wake up in the morning and I'd be testing my glucose, and he'd be like, "So what's going on?" And I was like, "Oh, my glucose is a little low right now." And you'd see the stress on his face because he didn't know what was going on. And he's like, "How could that happen? What's it like? What's wrong?" And it's just like, no, it's okay. It's okay. So then, I have to end up being the support system for him to keep him calm. And with my mother, she also didn't have a concept of what it was like. But I'll tell you, 2 years ago, my mother, she was in her early 60s. and she started to get some symptoms that she wasn't quite sure about, didn't know what it was. And she ended up going to the hospital and being diagnosed type 1 diabetic at 61 years of age. And so now we have an incredible support system with each other to where we're sharing, okay, so if you're experiencing this with your long-acting, what do you do? How do you manage that? Okay, you're experiencing this with this type of food. How are you managing that? And you know, we can be quite similar. We share similar genetic makeup, and so we have a similar response in our bodies to different sources of carbohydrate. And so we can talk about it and troubleshoot and find creative solutions to getting through the days, and also staying on top and making sure that we're having good time and range. And it's so funny, you know, it's something that I would have never imagined, you know, when I go to visit my mother and I go into the cupboards and I see the little candy stash and I know exactly what it's for. Or there's times when one of us have our alarms going off. And for a while, when I was newly diagnosed, if my alarm on my CGM was going off, that I was low, for her it was like, Logan, take care of it. Go get sugar. Do whatever you need before this turns into a serious issue. And now for me, when I hear her alarm going off and with a low or hypo in the middle of the night or something, it's going to wake her up and say, Mom, go take care of it before this develops into something worse. And so it's funny that in the relationships like that on the support system, it's always give and take. And I think that in a lot of senses, like again, with parents, with children who are living with diabetes, that as that child grows up, that the roles are going to change a lot. That it's going to be that the child becomes a great support and inspiration for the parents, because the parents will have been through everything with them, and not just with diabetes, but with raising them as people. And that in the conditions like that, the child will then grow up and be the support for the parents who have taken care of them for all the years. And so, again, the support is critical, and critical in getting it to the point as well, like I mentioned with my teammates, to where diabetes doesn't have to be the focus of the conversation, because we are, after all, people. We have different things.
Correct. Thank you, Mr. Logan. Mr. Alex, we have discussed the role of, the essential role of the support system, and that can be achieved through advocacy, like you have elaborated earlier. So what can, be done here in Goa? How do we strengthen, advocacy efforts? Like, how can we get the community involved to express our support, for individuals with type 1 diabetes?
I'll go back to my days in Mumbai, how we got started.
Right.
Just if that effort could be duplicated, I would think. I think it's largely about bringing people together. Whether you call it a support group or whether you call it misery likes company. I don't know, whichever way you look at it, whatever the perspective. Just that being together, that sense of belonging, that oneness, someone like me, someone in my boat, is the first step. So, where it came to, my days at Juvenile Diabetes Foundation Maharashtra chapter, what we used to have was, we used to have these monthly meetings or bi-monthly meetings. So when we were kids, they would invite some kind of a celebrity, some TV star or whoever. That was the attraction for us. Okay, so we would go running for those meetings, and like I said, there would be postcards sent to us. And this Sunday or whenever next the meeting is, so and so will be coming. So I must go for the meeting. So as kids, we used to go more to see the celeb or whatever. But that is where the bonds were forged. That is where we came together. So besides these bi-monthly meetings, we also used to have an annual education camp for 3 days. Now these 3 days together, and it would be away from Mumbai, like a Khandala or a Lonavala, on the fringes of Mumbai beyond. So that gave us a lot of time, togetherness, to get to know one another. That's where we really made buddies. Because at the bi-monthly meetings, or, for example, at the GMC, where they have their OPD, I meet this kid just for those 15 minutes, maybe half an hour, and then next, the doctor calls me, okay, tata, bye-bye, now I have to go, and then you go your way, I go my way. That bonding cannot be forged in such a short span of time, I would think. So maybe a 2-day education camp. It's not just the support. Don't start with, I think there are multiple factors to these meetings. It is that coming together, maybe someone like a Kartikeya might see another 18-year-old, 19-year-old, hey, come on, let's get together. We'll be there for the camp. That's how we used to get together. And there is also that education that happens. That's where our doctors at JDF, at the Juvenile Diabetes Foundation, that's where they taught us to be independent, to live life. Like every small thing, I did not have to go to my diabetologist. Dr. Ankush is busy, so I don't have to go to Dr. Ankush for every small thing. So they taught us the basics of dose adjustments. They taught us, how to interpret your urine sugar reports, small things like that. And that is where I think, one thing led to another. And then you realize when you're in a group, like it typically happens in any group, oh, this person, feels as strongly as I do about, let's say, sports, or let's say about advocacy. I didn't like what happened, with Alex being rejected from a job, for instance. Come on, let's get together, let's do something about it. Someone like a Logan might get together, and have his sports team. Come on, let's get together on that. So that is where these bonds are forged. But the first step, I would think, is to come together, to get to know one another and to spend time with one another. So something like a 2-day education camp, 3-day education camp can bring these kids together. And I think I would not expect doctors and healthcare professionals to take that initiative. It has to come from either the kids who are now grown up, or it has to come from the parents, the initiative themselves. That is something which you will be contributing, you will be investing for your kid's future. Because your kid needs to know that there are many others like me in the city.
Thank you, Mr. Alex. Mr. Dauber, just continuing with what we had discussed earlier, how do you see, the future for Team Novo Nordisk in terms of, future collaborations and, creating more awareness? And then, like you said, empowering, encouraging, and inspiring. If you could add on that, please.
Yeah, I think for us, the journey continues. We're a dozen years into this journey. We're impacting through the work of Logan and his colleagues many thousands, maybe tens of thousands of people around the world each year. But a little bit back to what's just been said, I think we've got to figure out how to scale this education on a much broader level. And maybe that involves interpersonal communication, maybe it involves advocacy, maybe it involves groups of people, but it also may involve computer engineers. It may involve other ways of educating people with the truth and the accurate information that kind of gets over a lot of the fake news that I was talking about before. And I think that we're on this journey to continue with Team Novo Nordisk, also to inspire people with living with other serious chronic diseases, but to continue to educate, empower, and inspire.
Thank you very much. So I would like to thank all the panelists here for their, enlightening us about their truly inspiring stories, which was very informative, and giving us a better understanding, that type 1 diabetes is indeed a treatable condition which can be managed, especially with the newer therapies available, and that we have a very robust healthcare system here in Goa to help individuals with type 1 diabetes and their families as well. So thank you, everyone. Thank you very much.
Hello everyone. I would like to thank the panelists and our moderator, Dr. Janice, for giving us so many different perspectives to living with diabetes and inspiring others. I would request you all to just stay on stage. So as we discussed during the panel discussion that nutrition is such a key part of managing diabetes. So we got a team of diabetes educators in Goa to create a recipe book which is not just for people with diabetes, but for everyone. And it has that local element to it with a lot of Goan recipes. So I would like to request Dr. Vandana Dhume, Dr. Rupa Nayak, Dr. Kedar, and Dr. Mohan Rao Desai to please come on stage and join the panelists in unveiling of the cookbook. As well as Divakar, Mr. Divakar, if he's in the audience. I request you all to please unveil and open the cookbook for the audience. This one is in English, but we will make the local language available as well. I request my team to please distribute the cookbooks through the audience. Thank you. If Dr. Dume, Dr. Rupa Nayak, and Dr. Ankush can please stay back on stage. Thank you. So, for people living with type 1 diabetes, life itself is such a balancing act. You have to think about monitoring of blood glucose, insulin, exercise, diet, even social dynamics, and sometimes stigma as well. So, as we at Novo Nordisk, we've created a confidence kit for people living with type 1 diabetes, which includes a logbook, a parent's handbook, an insulin site rotation grid, comic book for the kids, an emergency card, and a Betty soft toy to help educate and empower those who are living with type 1 diabetes. I would like to invite 6 children. Brother Sushant, if you could help us bring them to stage, who will be presenting the kits too. Stay. For the rest of the children in the audience, the kits are available for you at the registration counter. Please do collect them on your way out.
clap for all of us.
Yes, and a big clap for everyone, please. Thank you so much. I request Dr. Dume to please address the audience with a few words for healthcare in Goa.
Hello. Yeah, good afternoon, everyone. I know it's time for lunch. All of us are hungry. Just about 3-4 minutes, I will take your time. First of all, I would really like to thank Novo Nordisk for organizing such a huge event for Tour the Diabetes. And the panel discussion, thank the panelists also, because in the last 1.5 hours, I think I have gained a lot of knowledge about diabetes, type 1 diabetes also. In the morning, where we had a cyclothon, and it was amazing to see so many young children, kids, who had participated in the Zumba as well as in the cycling race. So I should really appreciate and thank all the parents who have brought these children here without any stigma, and appreciate the children also who came without any hassles and participated in the cyclothon as well as in the Zumba. I think they really enjoyed the Zumba session in the morning. We missed many of you who didn't join the cyclothon. Now I am just here. We know that whether it is diabetes type 1, type 2, there are 2-3 things which are important, which can make us live a more than normal and healthy life. It is a combination of diet, exercise, and medications. Am I right? Yeah. So to do all this, it is an individual as well as a responsibility of the family and the community. We are glad to know that people are coming out and coming in the open and expressing that they are having diabetes and they would like to have social groups, support groups and all. So it's a good thing that people will lead a healthy life, children will lead a healthy life, and all of us have to be very supportive in this endeavor of theirs. Now I am here just to inform you that we at the Directorate of Health Services, what are we doing to achieve this for our community and for the children itself. So we believe in early detection and prevention. For that, we are prioritizing the early diagnosis and prevention through regular health screenings and awareness campaigns. Our healthcare centers like PHCs, CHCs, district hospitals, medical college are all equipped to provide accessible and affordable care, wherein free drugs and diagnostics including insulin is made available at all the government health centers. In case of comprehensive care, we have established specialized foot care and ophthalmology clinics to address the specific needs of individuals with diabetes. These clinics offer timely interventions to prevent complications. Leveraging government initiatives, we are actively integrating our efforts with the Ayushman Bharat Health Scheme, now known as Ayushman Arogya Mandir. This scheme provides financial support to patients, enabling them to access quality health care. Innovative digital solutions, we have launched a comprehensive digital diabetes registry to track the number of people with diabetes, monitor their health parameters, and allocate resources effectively. This digital tool will help us identify trends and implement targeted interventions. Promoting a healthy lifestyle, we are promoting healthy lifestyle choices including a balanced diet, regular physical activity through the NCDC health camps, and Eat Right initiatives. Just to inform the House that we are getting CSR partners for continuous sugar monitoring for our patients very shortly. So our ultimate goal is to create a diabetes-friendly environment where individuals can live healthy and productive lives. By working together, we can reduce the burden of diabetes and ensure a brighter future for the generations to come. I urge everyone to prioritize their health, adopt healthy lifestyle habits, and seek timely medical attention. Let us all join hands to combat diabetes and create a healthier Goa. Thank you.
Thank you, Dr. Dume. As a project manager myself, working closely with DHS, I feel very proud to work in the Changing Diabetes Barometer program, because I feel the Goa government here is doing an excellent job at reaching out to patients with universal healthcare and access to medications and counseling. So thank you so much, Dr. Dume, for your words. Finally, we would like to end this session with Mr. Diwakar Mittal giving us a vote of thanks.
Thanks a lot. On behalf of Novo Nordisk, I want to personally thank all of you for coming, spending this time. And as I said in the beginning, this work is like our calling. We are really, really driven for this. And we truly enjoy our partnership here in Goa with the government. It's been supported very, very well. And type 1 is one very important area which we continue to work, continue to drive with the spirit of taking in charge. So truly appreciate and thank you, ma'am, for all the support, sir, for all the support. Round of applause to all of them who have been supporting. Our pro cyclist, Logan, who is here all the way from US, and he's going ahead, and we have a full week. Tomorrow we are in Bombay, then we go to Delhi, and then we are in Bangalore, so it's a lot of work. And in fact, Mr. John Dower, who really supports us from our global business unit over here. So thank you so much, all the panelists, all the audience, to really coming forward and working together. We are open now for the lunch. Please join us. Thank you.